And while you're a cardiologist who has gotten into the world of AI and you've worked with Olympic athletes, tell us a little bit about the moment when you felt AI was going to change the way cardiology helps people.
Thank you, Ken. It's a pleasure to discuss about AI with you. So at that time, I was a cardiologist and I was also a scientist doing research in a research center. It's the Spanish Cardiovascular Research Center here in Madrid, and also working at the hospital as a cardiologist and with Olympic athletes to prevent sudden cardiac arrest, to prevent heart attacks. So dealing with the first cause of death worldwide, which is also the largest driver for the healthcare costs. Right? And you are there and you are working with engineers, you are working in machine learning algorithms, and my co-founder was doing a PhD on that. And at the same time, you are at the hospital and you look around, and we doctors, we were doing a repetitive task, which is the reading of the EKG. And you look at around you and other hospitals and they do the same. So the entry point to diagnose many of those cardiovascular conditions was the reading of the EKG. Right? And at the same time, I saw the power of code, the power of machine learning doing that task and able to automate that reading and reduce this task that today takes almost 1 million hours a day of doctors in Europe doing this reading of electrocardiograms, the electrical signals of the heart, and that software can do that in seconds or milliseconds, right? That was the moment where I realized that there was a better way to do it, a better way to start this diagnostic process of cardiac conditions, and it was fully aligned with what I have been trying in my entire professional life, which is to prevent cardiac death and to prevent cardiovascular conditions that can be avoidable. We know that 80% of deaths can be avoided, and we are talking about almost 20 million deaths a year due to cardiovascular conditions. So are you able to bring new technologies through AI that allows you to measure new things that have never been measured before to make healthcare systems more efficient and more resilient? That was the idea.
It's fantastic work you're doing. And we're hearing stories like this all across Europe, that people use AI to address social challenges from healthcare to climate change. Now, I know part of the challenge you wrestle with is dealing with the regulatory environment. Tell us a little bit about how regulations are affecting time to market for a company like Idoven.
So our product is an AI model. It's called Willem, to honor Willem Einthoven. That was the father of the EKG, the person that got the Nobel Prize because he invented that hardware machine, and we are building a software on top of that. And we have gone through a very long process with our product, with our AI model. You need to solve very challenging engineering problems, and we have been able to solve some of them. You have to solve scientific problems, you have to demonstrate clinical proof. But once you get there, you also have to get clearance, because time to market is time to clearance. If you have rules that are too complex for startups, now we have a strong compliance team, right? But I look around and I see all the startups without this capability, and all the time and euros we have spent going through that process, this can reduce the advantage that you can get. And I think in Europe and in other places in the world, we need to switch from as fast as possible R&D and scientific breakthrough to product readiness, because it's not just about doing the scientific paper, it's also about how this paper can, and this scientific breakthrough can become a product, and how this product can reach the patients and the doctors if there is a strong value proposition for the healthcare system on reducing the waiting periods to get a diagnosis, on avoiding being admitted at the hospital, which is many times one of the largest cost driver, and the burden for healthcare systems or the impact on family and patients. So is AI able to reduce these healthcare outcomes? And if so, how fast can you release new versions of this AI to improve this value proposition? Because AI is like this. AI is about understanding how to regulate software. And software is about being able to release beta versions and new versions in a production environment quite fast. So you are able to bring the value of the new features to the market as soon as possible. And this gives you the advantage to compete at the regional level and then have the right to play at the global level. So I think we are becoming a strong player in Europe, probably market leaders in our field. But how do you get to the right to play in other regions? By moving fast and bold when you are trying to create these breakthrough technologies.
And that focus on patient care and making a real difference in people's lives is really key. And as the regulatory system, the healthcare systems tries to strike the right balance between speed to innovation and patient trust, getting that right is essential. So you've talked about the notion of thinking globally here. Why is it so important for a company like Idoven or startups in Europe to think globally?
I truly believe that for innovation to occur, at least in science, we have to create new technologies that allow us to measure new things. And AI is allowing us to do so. AI is like the microscope of the ECG, or RAI is like you zoom in into the electrocardiogram and you're able to understand current cardiac patterns, but also novel cardiac patterns, novel digital biomarkers within the signal that allow us to early diagnose conditions. Through prediction algorithms we did on the past, we were the first team being able to predict the behavior of one disease and the progression of one disease. To do so, you need to design locally, and there's a beautiful story, which at the beginning we were using OKRs, objective and key results, and one of them was we are gonna open operations in a new city every 30 days. Right? Very ambitious for a very small team of less than 7 employees, right? And at that time, in 2018, that goal obliged us to design differently. You are designing local, but you are thinking heartbeats are beating the same way all over the world. The ECG is a universal language. Are we able to build a model that will put together all the pieces of the puzzle to really change the way we are diagnosing those patients? That was the idea. I think it was a very ambitious goal, but we were able to do it. We were able to open operations and to get analysis of heartbeats and electrocardiograms from patients in different regions, in different countries. And now we have built one of the largest, most beautiful ECG database and heterogeneous database that science has ever captured. So thanks to that and to all the collaboration with hospitals like Puerta de Hierro Hospital here in Madrid, among many other hospitals in Europe and all over the world, key opinion leaders, scientists, and our team of engineers, and Google support that we have had since the beginning, so leading pharma companies, leading tech companies supporting us. This collaboration is the one that allows you to think global and to really try to impact the healthcare system to make it better and to make it stronger and more efficient for the benefit of the patients and their families.
It's wonderful to hear the story. Ambitions like that, coupled with the success of a company like Idoven, are not just fantastic for improving health in Europe, but it's key, I think, to how Europe's economy is going to grow and be globally competitive. Your success is proof of what's possible. So thank you for sharing your story today.
Thank you. And fully agree with that. Now, cardiovascular cost is, in the US, it entails 320 billion, more or less. That's the cost of cardiovascular costs today. And in Europe, is 280 billion annually cost. So we are talking about a massive problem, a massive challenge for humanity, because it's killing thousands of citizens and millions of citizens every year. But also, AI can reshape this market and digital transformation of healthcare, at least in cardiovascular, which is the space that I understand, will really create efficiency in the system. So fully agree with you.
It's a massive challenge and a massive opportunity. Thank you for all your work.
Thank you.